All right, great evening, everyone. And thank you for coming on to be a part of our mental health discussion for tonight with our special guest for the next 6 weeks. Dr. Mark Browning is going to be a great time of exchanging of information and even probably ideas to help those of us who are on a trajectory to develop a holistic approach to mental health, garner some wisdom and just some insight. And then at the same time, those of us that may be challenged or impaired in certain areas, perhaps some wisdom and practical things will be shared over the next several weeks to help you in that area. So if you're home and you in fact have family members that you feel like can benefit from this, or people who are not directly in your physical structure, go ahead and share the broadcast and encourage them to join in and be a part of what is happening tonight. This is an event that is hosted by our Community Development Corporation, known as the Shamar Group. Dr. Mark and I have been friends for a few years now, and now we share some kindred things. He's a great resource, very brilliant individual, and he's going to bless us. We'll bring him on in just a few moments. But if you could do me a favor and share this broadcast once again, encourage those you know and love who may, in fact, need to just hear what's going to be shared tonight, to join in and be a part of this. I see many of you coming on. Good evening to all of you, and thank you so much. You'll have him tonight, Friday morning, and then we'll repeat that for the next 3 weeks, next 2 weeks or so. So Mondays and Fridays, the dates are actually highlighted on the flyer. Robin Chrissy from Austin, Texas, good to have you on. I actually had communicated with someone from Switzerland, I believe, from a Periscope we did this morning that was challenged and said they wanted to be a part of just getting some information. And in this pandemic era of time, I'm sure a lot of us could just use some professional insight and practical wisdom on how to navigate some of the pitfalls and traps connected to just our mental well-being. So just a few more moments and then we'll go live. Also, I put an option out for those that may have questions that you want to try to get answered. There's no guarantee we will be able to get to them, but feel free to email admin@sagministries.com. That's ADMIN at sagministries.com. And we'll do our best to answer as many of the questions as we can. Maybe we can commit one of the sessions just to answering questions. And those that we do not get to on the actual live, we do have Ashley Telefero, who is a psych major. She will do her best to try to respond or provide some professional resources that in fact can help you with the questions that you may have. So thank you all once again for coming on. It's a Monday. It's extremely hot here in the Central Standard Time Zone, and the sun is still shining like it's 12 noon, but we're going to go for it here. So at this time, I'm going to bring Dr. Mark Browning on. He's going to share a little bit about his journey, and then he's going to get into his presentation. So let's give him a virtual clap. Dr. Mark Browning, good to have you on.
Thank you.
Good to have you. Thank you so much for gracing us and just making a commitment to be a part of the community via this social media platform and sharing your expertise. So I'm going to digress and let you go for it.
Oh, my pleasure. My pleasure. Thank you, Apostle. Glad to be of service. I pray that the information that I'm able to share with others in the audience blesses the people and gives them more knowledge and understanding of themselves and maybe others in their family or friends, but also gives them some direction in the event that they are experiencing or have family members who experience mental health concerns and are looking for resources to be in the best possible health, because that's what we're looking for people to be in the best possible health they can be.
Yes.
All right. All right. So my name is Dr. Mark Browning. I'm a licensed clinical psychologist. I am the director of the Linden Oaks Medical Group Counseling Services in Naperville, Illinois. Been a psychologist for about 12 years now. Started out actually as a nurse. I'm a nurse as well. I actually was a nurse before I became a psychologist, and then went back to graduate school and did some initial work in the forensic realm as a friend of the court, doing psychological evaluations for the court system in one of our counties in this area. Then did some private practice things for a short period of time, And over the course of the last 5 years, I've been the director of the Linden Oaks Medical Group Counseling Services, which is a traditional outpatient psychotherapy practice of about 45 therapists, licensed clinical social workers, licensed clinical professional counselors, and psychologists, working with a whole realm of issues from dealing with depression, anxiety, things of that nature, to couples counseling, to addiction services, things of that nature. Also overseeing our behavioral health integration program, which co-locates psychologists and licensed clinical social workers with primary care offices. The mental health issue has really come to prominence in the last few years. I think people are really starting to understand how much our mind impacts our overall health, and doing work with primary care physicians has been really beneficial in helping in the holistic realm of people's health, collaborating with those physicians and advanced practice nurses in the care of people and helping them understand their illness, whether it be diabetes or in oncology or those kinds of things, and helping them get the best results. So hopefully the information I have can be a blessing to the audience. And with that, we'll go ahead and get started. So first slide, please, if that's okay. Okay, I thought in this first week we would get some fundamental background regarding mental health. So the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5, is really the Bible for psychologists and psychiatrists in understanding the variety of mental health concerns that people experience. So according to the DSM, what we call the DSM, mental illness is a mental disorder or a syndrome that's characterized by clinically significant disturbance in an individual's cognition, emotion, regulation, or behavior that reflects a dysfunction in the psychological, biological, or developmental processes underlying mental functioning. Mental disorders are generally associated with significant distress or disability in social, occupational, or other activities, and impairment in thinking and management of emotions or behaviors that cause severe disruption in relationships, academic work, life, and other daily functions. So to translate that, that means that mental health disorders impact the way that we think, how we make decisions, how we come to conclusions, our rational thought, deductive reasoning, things of that nature. Our emotional regulation, our ability to manage our emotions in an effective way, whether it's containing those emotions in situations in which they need to be contained, or not being able to regulate those emotions like anger in situations where we need to show some composure. It's an indication of some kind of dysfunction that either is taking place on a psychological level in relationship to trauma or crises or something along those lines, or biologically, in which we have issues related to our physical body and experience. Sometimes we can have challenges with thyroid disorders and things of that nature that can impact the way that we think and the way that we process information, things of that nature. But the overwhelming way, well, the most prominent way of, I think, of understanding mental illness is that these difficulties and adaptations impact how we conduct our work from day to day. They interfere with our relationships with other people. They disrupt our ability to manage things academically. Every area of life that we function in can be disrupted by mental health concerns, and we'll talk about that a little bit more as we move forward. Next slide, please. So as I was saying, the mental health concerns can be impacted by a combination of issues. The first and foremost is likely biologically. That's an indication that there may be some issue with our brain chemistry, with neurotransmitters or serotonin levels, which are the means of our bodies, our minds communicating with our muscles and our nerves. If there's something out of concern or out of whack with our levels, like for instance with depression, sometimes it's an indication that there are low serotonin levels that maybe need to be addressed. Genetics, our family history has an impact. We can be impacted by internal issues like infection. Sometimes what you find with older adults is if they may have an infection of some sort, a urinary tract infection, for instance, it impacts their mind and how they think, their judgment and decision making. brain defects or injuries, like if we have a traumatic brain injury, prenatal damage, like we see with uh, children of substance abusers, in which there's an impact on our functioning in that way that has to do with the chemicals that were in the mother's body throughout that time. Substance abuse obviously has its impacts, and poor nutrition can also impact us. Being malnourished can also affect our emotional functioning. Psychological issues, such as experiencing a severe trauma, can obviously undermine our ability to process information and think effectively. Important losses, like the loss of a parent or a close family member or a child, impacts us psychologically, or issues of neglect, or challenges that people experience in their relationships with others. Those are all things that can impact the way we function on a day-to-day level, with our emotional and mental health. Next slide. Environmental stressors are the other thing that really has a profound impact on our emotional functioning. Death and divorce. You understand there's a lot of people who are dealing with stress related to alterations in their relationships. A disaster, whether it be fire or a hurricane, or having your home lost in some kind of a natural disaster, can affect our emotional functioning. Dysfunctional, chaotic, or volatile family relationships. Some of us come up in households which are really very volatile, can be prone to unpredictable kind of behaviors, or violence, or things of that nature. Obviously can affect someone's emotional functioning. Feelings of inadequacy or low self-esteem that we often see with children or teenagers in this day and age. Challenges with job, school, work. Obviously, with what we're dealing with right now with the pandemic and COVID-19, it's impacted people's ability to work, and their concerns about their health and well-being. Social or cultural expectations. We've talked a lot lately in our social structure about the impact of things like racism or mistreatment, and how that impacts people. And then obviously substance abuse, which seems to show up pretty frequently. Substance abuse by parents or close family members can have an impact on us and our emotional health. So those three things are really kind of the foundation of mental health concerns that we experience. The dealing with emotional stressors, psychological issues, or biological issues. Obviously, there are things that take place outside of those, but those are the primary realms that are responsible for impacting our emotional wellness and well-being. Next slide. Mental health concerns have really grown into prominence in the last few years. I think we're getting a better understanding of how ineffective functioning in our mind and our emotions really impacts every realm of our life. And you can't go a day without hearing something on the news, whether it's about the suicide rates, or the people who are struggling with depression, or comorbid issues, healthcare issues that are severely impacted or undermined even further by a mental health concern like anxiety or post-traumatic stress. Research indicates that at this point in time, in 2020, there's approximately 1 in 5 adults, or 47 million people, who are experiencing mental illness in a given year at this time. To me, that's an astounding number, to think that 1 in every 5 people that you see may be struggling with a mental health concern. And that number seems to be growing from year to year. I think the last numbers I looked at were like for 2018, and it was more like 43 million. So the numbers continue to grow in really outstanding rates. Mood disorders like depression or bipolar disorder or anxiety is the most common cause of hospitalization for all people in the U.S. under age 45, which is also, to me, somewhat hard to believe. When we think people are checking into the hospital, that it's usually for some kind of biological concern or injury or illness of some sort. But those under 45 are often being hospitalized either directly for a mental health concern or for a comorbid issue. They have a physiological health concern, but a mental health concern is exacerbating that concern. Suicide is the 10th leading cause of death in the US and the second leading cause of death for people aged 10 to 35, which is an indication of how much despair people are experiencing in the community. These numbers seem to be rising with every passing year as well. We are losing a lot of people just out of the sense of hopelessness and despair, feeling like things are never going to get better, which is just another indication that we really need to attend to the mental health concerns that people are struggling with. At this point in time, depression is the leading cause of disability worldwide. So it's not just a US issue. We're looking at throughout the world. A profound number of people are struggling with depressed mood, and we'll talk about the symptoms that are involved in that and some of the causes, as well as some treatments that might be beneficial. Next slide. In talking about the connection between physiological health concerns and emotional health concerns, I believe there's a lot of stigma to having a mental illness or struggling with mental health concerns. And oftentimes people feel more comfortable seeing their physician or their advanced practice clinician or a nurse rather than speaking to someone in a mental health setting. So subsequently, we're seeing that up to 70% of primary care visits, regular doctor visits, have a psychological foundation to them. 50% of U.S. behavioral health care is provided actually by primary care physicians. So when we're talking about psychotropic medications that assist in managing anxiety or stress or assist with antidepressants, those are being given more so by primary care physicians actually than they are psychiatrists. Nearly 70% of psychotropic medications and 80% of antidepressants are actually prescribed by primary care physicians. Primary care physicians are doing an outstanding job, but in many instances, they may not feel comfortable with providing psychotropic medications because that is not their area of specialty. But I think they're doing the best that they can in their arena to ensure that people are getting their needs met on a mental health in a mental health approach. Additionally, nearly 50% of primary care physician referrals to outpatient behavioral health, 50% of those people don't make their first appointment. So these physicians are aware that they may not be the best or that their clients need something more specific regarding their issues and are making their referrals. But for whatever reason, mostly I think related to stigma, which we'll talk about in a moment, people aren't seeking the help. And you may feel this way. I think I have probably felt this way in the past too. I think we'll exhaust almost all of our other options before we actually go see a professional regarding our concern. We'll talk to our wife, our husband, our friend, our spouse. We'll talk to a best friend. We'll seek the counsel of a coworker. We'll exhaust so many other avenues before we'll actually go see somebody about the concerns that we might be experiencing. And as I alluded to before, the most frequent drivers, psychosocial drivers of medication utilization and behavior disorders, substance use, deficient social support, or ineffective coping, stress that we experience in the workplace. So it is really fascinating how much our mental health affects our physiological health. Next slide. I just alluded to this a moment ago. Stigma is a significant reason for people not seeking or taking part in the kind of help that may be beneficial, or the kind of resources that may be beneficial if they are experiencing an emotional health concern. Basically, what stigma is, it's a mark of disgrace associated with a particular circumstance, quality, or person. So we feel a sense of disgrace for issues that I think that all of us can experience in some way, shape, or form. And it's interesting to me because in physiological health, if I was to sprain my ankle, or I was having significant headaches, or there was a lump under my arm that didn't seem right, um, I, like most people, I think, would take the initiative to go see someone about that and have it just have it be addressed. But there's not a stigma that seems to be related to that. I wouldn't think that people would ridicule me for having a broken ankle. But if there's something taking place in our mind that's undermining our ability to function, we can really be a lot more reluctant to seek assistance for those things because of how we may feel that we may be viewed by other people. In terms of mental health, stigma is when someone views a person negatively or critically because they have a mental health condition. That also includes our view of ourselves. Oftentimes, we're our own worst enemy, that it doesn't sometimes take other people to make us feel ashamed or ridiculed out of seeking help for an issue that we're experiencing. Oftentimes, that comes from inside ourselves. We can really be our own worst critic. And so we're looking at how ways in which we can begin to show ourselves some grace and understand that we're not perfect, but we may have concerns like other people have concerns, or just like we would have a physical health concern, and that there's no shame in seeking assistance for that. Living with a mental health condition, no doubt, is difficult. The blame and secrecy that comes with that can cause us not to reach out for support. So learning how to avoid and address stigma is very important for us, especially when we realize stigma's effect. For instance, people experiencing mental health conditions can face rejection or bullying or discrimination by others. That just undermines support. It undermines recovery. It undermines our ability to really take care of ourselves and get better. Even though most people can be successfully treated, less than half of the people in the U.S. who need services will actually go out and acquire those services. And the next point, I think, is really profound, that the delay between the onset of mental health, the average delay between onset of mental health symptoms and actual intervention is 8 to 10 years. People are going long periods of time suffering from various issues that are undermining their quality of life, and don't seek services until 8-10 years down the line. And there's no telling how significantly those issues will have impacted us in that course of time. Like anything else, the earlier we intervene, the better. So if we can help diminish the stigma that's involved with emotional health concerns, I think we can really begin to make a difference in people's lives in that regard. Next slide. All right, there's no more slides. So as you can see in the brief synopsis, mental health concerns are impacting us on a broad level. And what I wanted to do now was to talk a little bit about some fundamental conditions. I think part of our time we're going to spend in the weeks to come talking specifically about trauma, but I wanted to address these 3 or 4 kind of fundamental mental health concerns, because when we deal with the issue of trauma, all of the 4 that we're going to talk about are inherent in the experience of trauma that people experience. So I think if we get kind of a little bit of a foundation, that'll help us a little bit later on as we talk a little bit more about trauma specifically. So the first one I really wanted to talk about was depression, which is a deflated feeling of sadness or being overwhelmed that causes us a great deal of self-doubt, a sense of hopelessness about our circumstances, undermines our ability to galvanize ourselves, to be motivated to do the kind of work we need to do, to be engaged with other people, to engage in activities. It can affect us with somatic symptoms Uh, but depression is probably the most debilitating condition, physiologically or emotionally, that people are experiencing in this day and age. And you can tell by the statistics regarding the worldwide impact of depression on people's lives that it's vast and all encompassing, and trillions of dollars a year are lost in productivity at work due to depression, either people's ability to function on their job or their inability to motivate themselves to get up and go to work. Depression is having a profound effect on people's lives. So when people are depressed, they may show a conglomeration of some specific symptoms. For instance, some change in their sleep patterns, either what we call hypersomnia, sleeping 10, 12, 14 hours a day, or early waking, insomnia in the middle of the night where we can't sleep and work frequently throughout the night and can't get back to sleep, insomnia and inability of getting to sleep. We'll see changes in appetite. They'll be either restricting or not taking in enough food, or overeating with excessive weight gain. There's a lack of concentration and difficulty in focusing and staying locked in on the tasks that we have at hand, a loss of energy, loss of interest in the activities that we generally like to do or would engage in very readily. That sense of hopelessness that I had talked about, feeling like no matter what, the things aren't going to get better. Feelings of excessive guilt, that we've injured someone or done something that causes us a sense of guilt that we can't get over. What we call psychomotor retardation or psychomotor agitation, which is really a fancy word for restlessness. Psychomotor agitation is a restlessness and inability to stay still, continuing to move. We can't settle ourselves and find any peace. Or psychomotor retardation, in which we're moving more slowly, that we're not reacting as quickly to things as we should. Our thought processes are sluggish and aren't crisp, and we can't follow or track information as quickly as we usually do. Also, physical aches and pains, more somatic symptoms. We may have headaches, muscle aches, tension in our neck. All can be signs of depression. And those are generally caused, the depressive symptoms are generally caused by things like trauma, as we had indicated before. Whenever anyone experiences a traumatic experience, it can be anything from sexual abuse or being robbed or accosted or something along those lines, or being in a near fatal accident, any kind of trauma, loss of a limb, things of that nature. Genetics can sometimes play a role. Family history of depression can perpetuate depression in the lives of close family members. Life circumstances, loss of a job, divorce, things of that nature. Having a newfound medical condition, a new diagnosis, can cause us to feel depressed or begin to experience a depression. Or excessive alcohol or drug use. It impacts the way our brain operates and can also undermine our emotions, leading to a sense of depression. So the treatments for depression are generally psychotherapy, different forms, cognitive behavioral therapy, dialectical behavioral therapy, ways that allow us to look at our thinking, how we process information, how we come to conclusions. Can also be a helpful resource. Medication management, there's a conglomeration of antidepressants out there that are beneficial in helping to lift or elevate someone's mood. If they have low serotonin levels, some of the serotonin, what we call reuptake inhibitors, can increase the amount of serotonin that's in the system, helping to raise our mood. There are more invasive kind of procedures, electroconductive therapy or ECT, which has come light years from where it was done, the way that it was done in the past, or transcranial magnetic stimulation, TMS, is another resource that people are utilizing. But it's more, those more invasive resources are for more entrenched depressions. So if people have gone through a course or courses of psychotherapy and courses of medication management without positive results, and they have what we call an intractable depression. Resources like ECT and TMS can be beneficial. And then we never want to forget alternative approaches. Really, they shouldn't be alternative. They're more natural approaches like nutrition and faith, acupuncture, things of that nature are oftentimes beneficial in helping people manage or deal with depressive kinds of symptoms. So it's a little bit about depression, sort of a quick course. The second one I wanted to discuss was anxiety. Anxiety is a very, very prominent disorder. I think I read something in my research just in this past week that over 40 million people are struggling with depression. With anxiety as well. Anxiety being a persistent or excessive fears or worry in a non-threatening situation, or so being overwhelmingly worried, anxious, or concerned about issues that don't merit that kind of attention. It's really pervasive, not only with adults, but a lot with children. In our practice, we see a lot of teenagers who are struggling with issues of depression. And there's, issues of anxiety, and there are a number of anxiety diagnoses that are more specified that we won't get into right now for the sake of time. But a generalized anxiety disorder, when there's an overwhelming sense of worry or concern about sort of everyday concerns, where there's social anxiety disorder, in which people are fearful in the presence of others. They're fearful of humiliation or making mistakes, and it causes them to retreat and not be as involved with people. More prominent anxiety disorders like obsessive compulsive disorders, in which people have to have either rituals or a certain order to diminish the anxiety that they're experiencing, that gives them some sense of relief, but has to be repeated over and over for the person to get to diminish their anxiety, and over to the point that it interferes with actual day-to-day functioning. So there are a number of types of anxiety, but anxiety is a very, very prominent issue that a lot of Americans at the very least are struggling with. There are emotional symptoms of anxiety, sense of apprehension or dread, feeling tense or jumpy, a sense of restlessness or irritability, anticipating the worst, being watchful of signs of injury, or being what we call hypervigilant, thinking that someone's going to injure us, or that there are things in our common day-to-day communities that we need to be fearful of. There's also physical symptoms that come with anxiety. Actually, anxiety is probably the condition that shows up most in a somatic sense. So it looks like a physical health concern when it is actually an emotional health concern. We experience a pounding of our heart, or racing heart, or what we call heart palpitations, shortness of breath, sweating for no apparent reason. It's a sense of tremulousness and inability to keep our hands from shaking. Headaches, fatigue, sense of insomnia, inability to sleep, feeling an upset stomach. A lot of times anxiety shows up in what we call GI or gastrointestinal symptoms. A lot of people carry their anxiety in their stomach, so that can result in diarrhea or upset stomach, frequent urination, things of that nature. So anxiety really has the potential to show up in a physical state. So a lot of times, in most instances, the first place to start for treatment is sometimes with a physiological appointment with our primary care physician, who can help sort of give us some direction regarding what the concerns are, if there are legitimate cardiac issues, or the symptoms are more along the lines of a panic attack, an overwhelming sense of fear and dread when it's not warranted, things of that nature. So for anxiety, a lot of times the causes are genetic. Sometimes we have people who sometimes are just wound more tightly, who are more more anxious. They are more maybe more particular about how things are done, or have fears. Sometimes we have family members who struggle from that condition, and that can be kind of passed on genetically from parents to children, or grandparents and things of that nature. A lot of times anxiety is related to our environment. Um, uh, we live in a society that can sometimes be injurious. People can be cruel to one another. Circumstances are sometimes not what we would desire to have. Sometimes there's a sense of injury or unfairness that takes place in our lives, that can cause us to be a little more anxious and wary and fearful of the things that might take place in our life, and make us anticipate wrongdoing, or anticipate challenges, maybe without warranted evidence. So our environment can be really impactful in creating a sense of anxiety in us as people. And the treatments are also psychotherapy and counseling, which is also beneficial, having someone to help us understand what's taking place with our brain, helping us make sense of our environment and why we might be experiencing some of the things that we experience. Medication management, such as anti-anxiety medications, which help to lower our heart rate, to help us experience a sense of more of a sense of peace and tranquility. Medication managements, when used effectively, can be very, very beneficial. Some of them also have a high potential for abuse, so there's something that we just have to be conscientious of when prescribed medication. Complementary components like stress management, mindfulness, meditation, relaxation techniques can teach us to kind of self-soothe in circumstances in which we experience a lot of anxiety, so we can learn to regulate our own emotions, so that our anxiety doesn't run interference in how we think, and we can be more clear in how we come to conclusions and make decisions. So anxiety is the other issue that really is kind of has its own profound effects on people in the community, but also can be a part of trauma, as we'll talk about a little bit later. I didn't know if I should talk about psychotic disorders or schizophrenia in particular, but I landed on schizophrenia as a primary issue. It's a debilitating, a very serious mental health concern, in which a person's ability to think clearly, manage their emotions, make decisions, remain sort of grounded in contact with reality is lost. So schizophrenia is very, very debilitating. Its prominent symptoms are hallucinations, hearing, seeing, smelling, or perceiving things that aren't actually there, or that other people can't perceive, is profoundly debilitating. I think I saw a piece that Anderson Cooper did years ago, in which he walked around with headphones on, with a number of different voices talking to him at one time. And they had him try to do some tasks like origami or carry out a transaction, and he couldn't, because of the distracting nature of the voices that he was hearing. And it kind of gave an experience of what it might be like for some people who struggle with experiencing auditory or visual hallucinations, which can obviously be very disturbing. Delusions, false beliefs that don't change in the presence of facts or new ideas. So people with schizophrenia struggle with I don't know how to say it other than beliefs that aren't based in reality. I guess we can think of paranoid delusions, in which people feel like maybe the FBI or some government agency is after them, or that they're being surveilled or watched throughout the day, and they have to conduct their life in a way that stays under the radar. Or delusions of grandeur, and people think that they have special or unique skills or capabilities, or they're a special person, a special historical person, or feel like they're Jesus Christ or something along those lines. Aromatic delusions, when we think people are in love with us, people that we only saw on a television show, that we have no personal relationship, somehow have feelings for us. There are all kinds of delusions that can be very debilitating. Another prominent symptom is what we call negative symptoms. And what negative symptoms are really a diminishing of our life, if we want to think about it that way. So there's a bluntness or flattening of people's affect, of their countenance. There's no emotion that's shown. There's what we call poverty of speech. Their inability, they don't know what to say, or they don't say. Their speech is restricted. They don't talk in normal circumstances. They don't relate. They have apathy or diminished interest or investment and motivation in anything. We just can't get themselves to get the motivation to get up and moving. Diminished social drive, disconnection or disengagement from interactions. All those can be symptomatic of schizophrenia. One of the most prominent things, though, is what we call disorganized thinking, in which people are carrying out their lives or making decisions in a way that don't make sense. So people with really severe schizophrenia, you may see dressed in a number of layers of clothes on a 90-degree day, or they they have what we call word salad, or just putting words together that don't make sense in context. So bizarre speech and things of that nature. It's a very, very debilitating condition that needs attention. The causes oftentimes are genetic. Sometimes they are passed down. I think people can be 6 times more likely to suffer from schizophrenia if they have an immediate family member who suffers from schizophrenia as well, a parent or sibling. Brain chemistry is impacted. Dopamine levels in the brain can impact people's senses and their perception, and can have an impact in the preponderance of schizophrenia. Substance abuse, using substances that maybe have been adulterated with some type of contaminant, can bring on symptoms of schizophrenia. And then obviously environment or trauma can have a profound impact on people's emotional health in that way. The treatments for schizophrenia are oftentimes the use of antipsychotic medications to help people get into a place where we diminish the impact of the voices and the impact of the visual hallucinations, so that people can be a little more grounded and use actual psychotherapy in an effective way. If they're overwhelmingly impacted by the stimuli that's not really actually taking place, then it's hard for them to utilize services like education or psychotherapy or things of that nature. And then self-management strategies, obviously getting to know more about the condition and what kinds of treatments are available, and those kinds of things are sometimes beneficial and helpful as well. And the last one I really wanted to touch on was really actually post-traumatic stress disorder, which is when we experience profound or overwhelmingly traumatic events. It can impact, obviously, the way that we function, the way we feel about ourselves, the way we feel about other people, the way we carry out our duties day to day in life. So we'll see that oftentimes in people who have returned from military service and have been in combat, people who have been assaulted or taken advantage of. Oftentimes will can experience post-traumatic stress if they've been in a life-endangering circumstance of any shape or form. Can bring on symptoms of post-traumatic stress, and many of those experiences one is what we call re-experiencing. You may know it better as what we call flashbacks, but what they are involuntary intrusions of the event. So re-experiencing the event in present time, not being able to hold those thoughts back. So sometimes people will have distressing memories, flashbacks. They'll have really bad dreams. There'll be a replaying of the trauma that they were involved in, and we just can't keep those things at bay. Oftentimes there's avoidance or staying away from people or objects that remind us of the trauma that we experienced. Just avoiding those things altogether, with the sense that if we go in this direction or we're in contact with these people again, similar things may happen to us. There are cognitive and mood symptoms, memory lapses, negative self-thoughts, feeling very badly about ourselves, or that we somehow were maybe deserving of what happened, or that things always happen to us and not being able to get out of that. We may feel numb, have no sensation, not feel any emotions whatsoever, or be worried or depressed, or have what we call depersonalization or out-of-body experiences. Sometimes people feel as though they're outside of themselves, viewing themselves. That is sometimes one of the symptoms of trauma, or derealization, which is feeling like the world around us is not real. Or their arousal symptoms. We go back to the issue of hypervigilance, that suspiciousness, or always being on alert that we're under threat of danger. And that makes it almost impossible for people to relax and have peace if every moment of the day there's a sense that danger is looming right around the corner. We might have a heightened, what we call startle reflex. So if a book drops on the floor, or a loud noise takes off, it causes us to startle or jump, because we're in just this heightened sense of fear. We may have some experience night terrors in their dreams, where there's overwhelming fears, and they're screaming because they're concerned about what's taking place in that world. And we may experience anger outbursts as well. It's not unusual for people who suffer from PTSD to have sort of a quick temper, or respond more drastically than they would given the circumstances. And sometimes that is a strategy for keeping people at a distance, because if we can keep people a safe distance from us, then there's less chance for injury. So we may see that. And the cause of that is obviously exposure to a severe trauma. We have them every day. So it's not unusual that the numbers of cases of PTSD that we see are also going up rather exponentially. And those treatments also involve very similar psychotherapy, medication management, some self-management strategies, which we're able to sort of soothe ourselves and begin to make sense of our circumstances and make better decisions. Mindfulness, meditation, sometimes things like service animals are helpful in helping us find a sense of calm and peace. So those are the kind of the four fundamental conditions that I wanted to talk about in particular, because they are all somewhat inherent in the experience of trauma that people have. But there are a number of diagnoses that I would be glad to discuss and take questions on over the course of our next 5 sessions. So I hope that was helpful. It's a lot to cover in a very short period of time, but I would be glad to take any questions I can that might be beneficial in helping people understand a little bit about what we talked about.
All right. Excellent job. Thank you so much. I think everybody probably located themselves to have some sort of mental impairment on the broad spectrum that you covered. I think one of the most alarming points of information you brought out was the fact that sometimes people can go for almost a decade
Yes.
without actually getting a diagnosis, or even determining that they in fact have been compromised. So out of the 3 questions that I had, you kind of answered all of them, like literally, because
wow.
of the physiological impact of mental issues, and how sometimes it can mimic like a heart murmur, but actually it's anxiety. Or you could have, muscle aches and problems in the neck, but actually you could be dealing with this type of depression, or something from that aspect. So there is a connection between the two. But what I wanted to ask, I think kind of just for the audience in general, is that if I suspect that myself or a family member is basically mentally compromised or impaired, what would you deem to be like the first steps, or the first step to take?
The first step is obviously talking to that person to see if uh, where they're at in regards to understanding the concerns that they have and being able to bring them another perspective or just observation. And oftentimes it's about sharing what your observations are rather than telling something what they're experiencing. Because I think it's hard for people to dispute the observations. On a more clinical sense, it's sometimes always best to start with medical issues. To go back to what you were talking about just a minute ago about the physiological health issues, I think we always sort of want to. Our rule of thumb is to rule out physical health concerns first. For instance, hypothyroidism, for instance, can mimic depression. It's really our thermostat. So we maybe don't have energy, that we're gaining weight, that we're eating excessively, that there's apathy and lack of motivation. We want to rule out any health issues, if it's a thyroid issue or something along those lines, and rule those things out and then get help. And then if we're looking for assistance, there are programs like mental health first aid that take place in communities to help us recognize what mental health concerns are and to get people to the right connections. Much like first aid, if someone's having a heart attack, we're not expected to perform surgery on that person.
Right.
What we are expected to do is to help that person maintain till we can get them to a person who can be a resource for them. So if we can collaborate with that person, be with them at an appointment, whether it's for a primary care physician or it's seeing a social worker or a psychologist, or it's going to a community health center or something along those lines, being with that person and walking with them through that is usually the best way to get someone kind of acclimated and on that path.
Okay, excellent. Well, I know our time has been well spent. Once again, excellent presentation. You did cover quite a bit. I'm like, well, I need to go get a consultation now and get diagnosed, make sure I'm free of depression and anxiety, no open doors. But it really just has you kind of thinking to bring things into perspective. You're thinking about your thyroid, hyper, and, heart palpitations, and you think you're having cardiovascular issues and you could be dealing with anxiety.
Could be a panic attack. Yeah, absolutely.
Yeah. And the fact that you guys understand that sometimes the brain can have a person from a physiological aspect actually mimicking things that are inconsistent with what's happening in the head.
Yes.
Wow. And once again, I'm still stuck on the 8 to 10 year window, and before people can even realize what's happening.
Yeah, well, I think that speaks to how profoundly we feel about ourselves if we're experiencing a mental health concern. That we will exhaust almost every option before we actually see a professional. And oftentimes we do our own self-soothing through the use of substances or alcohol. So it may be that we're experiencing emotional distress and we're trying to cope with that with other measures that aren't helpful. People seek it in relationship with, stress or indiscriminate relationships or the use of substances or gambling or distractions, even, excessive involvement in sports or things of that nature that really kind of mask what it is that's taking place. And we can do that for years before we're willing to say, hey, there's really something going on that I really maybe need to talk to somebody about.
Yeah, man. Okay. So, well, with that, having said that, Dr. Mark, we're going to close this session out. Once again, thank you. And then for all of you who are on the live tonight, there's an email address that you can send your questions to. And let me qualify the questions. The questions need to be directly consistent with a mental health / illness issue that you perhaps need just some clinical clarity concerning. So don't send the spiritual stuff and tie it in. We're not dealing with that. We're dealing with the medical aspect of mental illness and how people's lives are grossly impacted. Even when you said that globally, that there's more like issues with depression.
Yes.
And time off of work, or however you pin that, than any of the other problems that people are having with employee to employer.
Yeah.
Wow, that's globally,
Yeah, totally.
not just an American thing. So people all around the globe are dealing with depression. Yeah.
Absolutely.
Wow.
Absolutely.
Wow. So we'll have Dr. Mark will be back on. We'll be back on Friday morning at 10 a.m. Central Standard Time, because people get real particular. You tell them 10 o'clock. Well, I live on California, so will that be Pacific time or is it Eastern time? Just it's on Facebook and YouTube. If you don't get the right time, it'll be up for replay. So calm down, people. It's going to be okay. So thank you once again, Dr. Mark. Really appreciate you, and just your wisdom and the fact that you're a man of faith as well. So thanks. Please pray for Dr. Mark and his
Thank you.
clinical exploits in helping people to become better. I'm sure it has to be emotionally taxing and draining for you as well. So remember him, remember this man of God, pray for him, and just agree with him for longevity and clarity and functionality and in his assignment. So, all right, Saints, well, that brings this session to an end. It's Friday morning, 10 a.m. And then we will have Ashley Teleferro, who will be a part of the discussion with Dr. Mark on this Friday morning. So thank you once again, and have a great evening.
My pleasure. God bless.
All right, God bless.